Now, change the topic a little. In Australia and New Zealand, children's psychiatry meeting this week. Psychiatrists express their hesitancy to discuss gender issues. Yep, the woke world seems to be falling down around us. What a surprise. Or raise any concerns about gender dysphoria due to public scrutiny. They also sounded the alarm about the lack of evidence underpinning medicalised, is what we were just talking about, gender-affirming treatments, that's your puberty blockers, surgery, all that stuff in young people. And this is where the problem is. Joining us now to discuss is psychologist and author Tanveer Ahmed, Spectator columnist. How are you, Tanveer? Great to see you on this fine morning. Now, what's going on in the world of psychiatry? Is there a split on this gender dysphoria issue?
Well, the heat's going up on this whole issue, isn't it, Rowan? People getting fired left, right and centre, psychiatrists, journalists. And this partly comes on the back of, you'll know about Dr Jillian Spencer, who got fired from a Queensland clinic, largely because she expressed her caution regarding gender affirmation. Now we're getting, look, there's so many different specialists in the trans debate. Endocrinologists are the hormone specialists. You've got psychiatrists, you've got psychologists, and you've got the surgeons. What's happening is we're getting a schism between two of those groups. Endocrinologists, who are the hormone specialists, and psychiatrists. Endocrinologists have come out essentially suggesting that gender affirmation has better results in terms of subjective distress. So the mental health results in the longer term, they're arguing, or at least some groups are arguing. And psychiatrists have come out and they're meeting this weekend and saying, well, I think that's highly questionable. Now, this whole issue is contested amongst pretty much every specialty group. One of the big issues is what the research really does say, and often it depends on how soon you look. If you look at research about the mental health impacts a year or two after gender transition, sometimes it is positive. You can almost say there's a bit of a honeymoon effect where a lot of people who go through it and think, oh, yeah, I definitely feel better. But as soon as you look at it beyond 5 years, and some of the best research is from Sweden here, team, and the psychiatric impacts are indistinguishable for people who had no transition at all. So sorry, go on.
No, Tanveer, I just want to quickly show you this clip, which is a surgeon in Portland in the United States. I think it speaks for itself, but just have a listen to part of this interview with this character.
And then it's also hard to have that conversation with someone that maybe hasn't went through puberty or ever engaged in sexual activity. It's a really tricky thing. And when it comes time to actually do surgery, if an individual does go through suppression and ultimately is in their latter teenage years and wants a vaginoplasty, not only are you facing the struggle of not having a lot of tissue to work with, but that tissue hasn't been under the influence of testosterone, which definitely affects some things.
So, Tanveer, this interview gets quite repugnant in the depths that this character goes to, talking about surgery turning teenage boys into girls and vice versa. We talk about, your specialty is psychiatrist. We talk about the mental side of gender dysphoria. To what degree is that led by fashion? To what degree is it genuine? Obviously, it's different for every person. But the surgical puberty blocker, the physical side of it, are teenagers really aware of what they're facing?
Well, often not. And this is why there's a growing caution right across the world, which is the part of the reason why this is blowing up more, because you're getting more caution, not just from authorities, but also the different medical groups, including psychiatrists. And the US has led the way. So many states kind of banning or limiting gender affirmation. Look, if you look at the history of medicine, Rowan, medicine goes wrong when it treats the symptoms and not the cause. For example, when early in epilepsy, people get their arms shake, and the way we treat it is cut the arms off. Right, there's an element of this in the trans debate where people are getting some sort of psychic distress. There's all manner of other issues. And Dr Jillian Spencer, who got fired and is undertaking action, she talked about this where they'll have a trauma history, they'll have all these other psychiatric issues, and the notion of watchful waiting. The notion of watchful waiting is having caution and treating all those stuff around the psychic distress around gender. And as James alluded to earlier, often you treat that and the majority of people settle down. And suddenly the key issue is not this notion of some sort of gender dysphoria.
James.
And so, just to pick up on that too, I mean, we are seeing, and we have seen across the Western world, this explosion, Tanveer, of cases in this. It's become a huge issue, very contentious and quite rightfully contentious. But why is this? We have seen cases of schools and classes where there is sort of a contagion effect. Is there a cultural contagion effect that is turning what might be the normal ups and downs of growing up? And, the fact that a girl might like to play with trucks or a boy might, like more sort of feminine hobbies, that this, suddenly culturally becomes this solution that winds up with young people going through very dramatic and radical procedures for things that have always sort of been out there, but suddenly we've got a new name for it. And oddly enough, a whole medical industry around it.
Oddly enough.
Yeah, but look, in adolescence, you get an identity disturbance often. You're going through identity issues. I guess my big concern about the trans issue, which has basically become ground zero of the culture wars, it's really become a language now to channel all types of psychic distress and identity disturbance. And more often than not, it will settle down, like a lot of adolescent issues do, but then we have these permanent treatments. So absolutely, there's a huge cultural dimension that is accelerating this, right, especially across the Western world.
Tanveer Ahmed, psychiatrist, great to chat to you as always. Keep writing those great columns in the Spectator Australia, mate, and we'll chat soon. Thank you so much, Tanveer.